Respiratory infections can range from mild to severe and can be caused by various pathogens such as bacteria, viruses, or fungi. When it comes to treating respiratory infections, antibiotics are often prescribed to target and eliminate the bacteria responsible for the infection. It's important to note that antibiotics are ineffective against viral respiratory infections, such as the common cold or flu, as these are caused by viruses and do not respond to antibacterial treatments. Antibiotics work by either killing the bacteria or inhibiting their growth, allowing the body's immune system to effectively eliminate the infection. They are an essential tool in the fight against bacterial respiratory infections, helping to alleviate symptoms and prevent complications. However, it is crucial to use antibiotics judiciously to avoid antibiotic resistance and unnecessary side effects. Overview of doxycycline and Cipro. Doxycycline and Cipro are two commonly prescribed antibiotics for respiratory infections. While both are effective in treating bacterial infections, they belong to different classes of antibiotics and have distinct mechanisms of action. Doxycycline is a member of the tetracycline family of antibiotics. It is a broad-spectrum antibiotic, meaning it can treat a wide range of bacterial infections. Doxycycline works by inhibiting bacterial protein synthesis, preventing the bacteria from multiplying and spreading. It is available in both oral and intravenous forms, making it suitable for various types and severities of respiratory infections. Ciprofloxacin, commonly known as Cipro, is a fluoroquinolone antibiotic. It is also a broad-spectrum antibiotic and is effective against many types of bacteria. Cipro works by interfering with the DNA replication process in bacteria, causing them to die. It is available in oral, intravenous, and topical forms, allowing for flexibility in treating respiratory infections. Similarities and differences between doxycycline and Cipro. While both doxycycline and Cipro are effective antibiotics for respiratory infections, there are notable differences between the two. One key difference is their spectrum of activity. Doxycycline is a broad-spectrum antibiotic, meaning it can target a wide range of bacteria. It is often used to treat respiratory infections caused by common bacteria such as Haemophilus influenzae, Streptococcus pneumoniae, and Mycoplasma pneumoniae. Cipro, on the other hand, has a broader spectrum of activity and can effectively treat respiratory infections caused by both gram-negative and gram-positive bacteria. Another difference lies in their pharmacokinetics. Doxycycline has a longer half-life, allowing for less frequent dosing compared to Cipro. This can be advantageous in terms of convenience and adherence to the treatment regimen. Additionally, doxycycline can be taken with or without food, while Cipro should be taken on an empty stomach for optimal absorption. Effectiveness of doxycycline in treating respiratory infections. Doxycycline has demonstrated efficacy in treating various respiratory infections. It is commonly used to treat community-acquired pneumonia, chronic bronchitis, sinusitis, and other respiratory tract infections caused by susceptible bacteria. In the case of community-acquired pneumonia, doxycycline is often prescribed as an alternative treatment for patients who are allergic to penicillin or macrolide antibiotics. It has shown comparable effectiveness to other antibiotics in treating mild to moderate cases of pneumonia caused by common respiratory pathogens. Doxycycline is also effective against atypical respiratory pathogens such as Mycoplasma pneumoniae and Chlamydia pneumoniae. These bacteria are known to cause a milder form of pneumonia and are often resistant to other antibiotics, making doxycycline a valuable treatment option in such cases. Effectiveness of Cipro in treating respiratory infections. Ciprofloxacin, or Cipro, is widely used in the treatment of respiratory infections. It is particularly effective against respiratory tract infections caused by gram-negative bacteria, including Pseudomonas aeruginosa. Cipro is often prescribed for patients with chronic obstructive pulmonary disease, COPD, exacerbations, as these exacerbations are commonly associated with bacterial infections. In addition to treating bacterial respiratory infections, Cipro has also shown efficacy in preventing and treating anthrax, a severe respiratory infection caused by the Bacillus anthracis bacteria. It is considered a first-line treatment option for anthrax and has been used successfully in various outbreaks and bioterrorism incidents. While Cipro is effective against many respiratory pathogens, it may not be the first choice for treating community-acquired pneumonia caused by typical respiratory bacteria. This is due to the increasing rates of antibiotic resistance among these bacteria, which may limit the effectiveness of Cipro in some cases. Side effects and safety considerations of doxycycline. Like any medication, doxycycline can cause side effects, although they are generally well tolerated. Common side effects include gastrointestinal symptoms such as nausea, vomiting, diarrhea, and abdominal pain. It may also cause photosensitivity, making the skin more sensitive to sunlight, so it's important to take precautions and use sunscreen while on doxycycline. In rare cases, doxycycline can lead to more serious side effects, including liver toxicity, kidney damage, and severe allergic reactions. It is important to inform your healthcare provider of any pre-existing medical conditions or medications you are taking to avoid potential drug interactions and ensure the safe use of doxycycline. Side effects and safety considerations of Cipro. Ciprofloxacin, like any antibiotic, can cause side effects. Common side effects include gastrointestinal symptoms such as nausea, diarrhea, and abdominal pain. It may also cause headaches, dizziness, and rash. In rare cases, Cipro can lead to more serious side effects, including tendinitis and tendon rupture, especially in older adults. Cipro has also been associated with an increased risk of developing Clostridium difficile infection, a severe intestinal infection that can cause diarrhea and inflammation of the colon. It is important to notify your healthcare provider if you experience persistent or severe diarrhea while taking Cipro. As with doxycycline, it is crucial to inform your healthcare provider of any pre-existing medical conditions or medications you are taking to minimize the risk of drug interactions and ensure the safe use of Cipro. Choosing between doxycycline and Cipro for respiratory infections. When it comes to choosing between doxycycline and Cipro for respiratory infections, several factors should be considered. These include the type and severity of the infection, the bacterial pathogens involved, any known antibiotic resistance patterns, and individual patient factors such as allergies and medical history. In general, doxycycline is often considered a first-line treatment for respiratory infections caused by typical and atypical bacteria, especially in patients who are allergic to other antibiotics. It is effective against a wide range of respiratory pathogens and has a favorable safety profile. Cipro, on the other hand, is typically reserved for more severe respiratory infections, particularly those caused by gram-negative bacteria or in patients with specific risk factors. It may be used as an alternative treatment option when other antibiotics are ineffective or contraindicated. Ultimately, the choice between doxycycline and Cipro should be made in consultation with a healthcare professional who can evaluate the specific circumstances of the infection and weigh the risks and benefits of each antibiotic. Conclusion: the importance of consulting a healthcare professional. In the battle against respiratory infections, antibiotics such as doxycycline and Cipro play a vital role. While both antibiotics have proven efficacy in treating respiratory infections, they have distinct differences in terms of their spectrum of activity, pharmacokinetics, and safety profiles. When faced with a respiratory infection, it is crucial to consult with a healthcare professional who can accurately diagnose the infection, determine the most appropriate antibiotic, and consider individual patient factors. This personalized approach ensures the optimal choice of antibiotic and promotes the safe and effective treatment of respiratory infections. Remember, self-medication and the misuse of antibiotics can contribute to the emergence of antibiotic resistance, a global health concern. By seeking professional medical advice and following prescribed treatments, we can collectively combat respiratory infections and safeguard the effectiveness of antibiotics for future generations.